In this presentation, we will discuss mood and behavioral changes that can be seen in dementia. In this presentation, we will discuss mood disorders that we can start to see in individuals with dementia and how they can affect behaviors. We will discuss the causes and management of newly occurring paranoid ideas and hallucinations. We will discuss care refusal and how this can be managed. We will discuss aggressive behaviors, their causes and management of aggression. And finally, we will review inappropriate behaviors and management of these behaviors. Mood disorders in dementia. The term mood disorder is often used to describe psychiatric disorders such as depression and bipolar disorder. Anxiety often occurs alongside a mood disorder. Many mood disorders can appear to start when your loved one develops a dementia, or if they already had a mood disorder before the beginning of dementia, it can appear to get worse. Mood disorders can be the root cause of a lot of behavioral problems we discuss in this section, like aggression, refusing care, and even paranoid ideas and hallucinations. Treating a mood disorder can not only make your loved one feel happy and increase their ability to enjoy life again, it can also significantly improve your ability to care for your loved one. Depression. What does it look like? The classic signs of depression can be remembered with the mnemonic SAD, very sad. S is for sadness or tearfulness. A is apathetic. D for delayed movements and speech. S for sleep problems. A for appetite disturbances. And D for frequent wishes for death or dying. Additionally, since your loved one with dementia cannot often express when they are feeling depressed, these emotions can be expressed in other ways, such as refusing care or medications, appearing withdrawn or not wanting to spend time with loved ones, becoming irritable, and arguing or even becoming aggressive. Anxiety frequently occurs with depression and can often at times seem more prominent than depression. Depression. How can we treat it? It is advisable to talk with your loved one's physician if you suspect depression, because they will be able to discuss both medication and therapy options that are available to treat depression. Your loved one's physician may prescribe an antidepressant, often a selective serotonin reuptake inhibitor, SSRI, or selective serotonin and norepinephrine reuptake inhibitor, SNRI. Be sure to talk with your doctor about any side effects you would expect to see from these medications. There are therapists that can still work with individuals with dementia and depression, depending on how severe the dementia is. Depression. How can we treat it? As a caregiver, you can also do things at home with your loved one to help address depression. Some of the things you can do include provide reassurance that your loved one is safe, will continue to be cared for, and is understood. Try to encourage time with loved ones they enjoy. If group visits are too stressful, one-on-one visits can also be meaningful. Encourage involvement in hobbies and activities they had previously enjoyed. Keep in mind, you may need to modify these activities to fit their skill level and make them more enjoyable. Bipolar disorder. What does it look like? Bipolar disorder can be a pre-existing mood disorder before the person had dementia, or it can develop also due to brain damage from dementia. Bipolar disorder was often referred to as manic depressive disorder in the past. Someone with a bipolar disorder can have periods of depression, as discussed in the previous slides, and episodes of mania. Symptoms of mania can be remembered with the mnemonic "go fast." G stands for grandiose thinking. They may think they have superpowers or special abilities. O is for overly emotional. Your loved one may laugh inappropriately or become inappropriately angry or upset. Emotions can change quickly and without much cause. F is for focusing difficulties. A for active, more than usual. S for sleeping problems. And T for talkative. Speech can be fast and ideas sometimes don't make sense. Bipolar disorder. How can we treat it? Bipolar disorder is a complex mood disorder and needs evaluation by a medical professional as soon as possible for appropriate management. Your loved one's physician may prescribe mood stabilizers to help keep symptoms of bipolar disorder in control. Lithium, certain seizure medications, and antipsychotic medicines may be used. It is important that the individual with bipolar disorder take the treatments recommended by the provider, as untreated bipolar disorder can lead to aggression and psychotic symptoms, delusions, and hallucinations that would make it difficult to care for someone at home. Delusions and hallucinations. What are the causes? There are many different causes for delusions, false beliefs, and hallucinations, false sensations, that you can see in your loved one. Number 1 is agnosia, not recognizing people or objects. This can lead a person to not believing their home or their loved ones are what they really are. Forgetfulness. This may lead to misplacing items and then thinking they have been stolen. A mood disorder. Mood disorders can cause strange delusions, like thoughts that the people are coming after them, or that God is speaking to them. Acute illness. Acute illness may cause visual and auditory hallucinations, like seeing animals or people that are not there, or hearing sounds that are not there. Usually, you will also see worsening confusion during this time. Medications. Vision problems. Vision problems may cause vivid visual hallucinations or illusions. An illusion is when someone sees an object and thinks it is something else. Finally, brain injury. Damage to the vision and hearing centers of the brain may cause hallucinations. Managing delusions or hallucinations. First, provide gentle reassurance. Assure them they are in a safe place. Physical contact, like holding their hands, may be a good form of gentle reassurance. Don't argue, try to redirect. The experience is very real for your loved one, and challenging them will cause them to be more upset. If your loved one is having a hallucination, you can say, "I don't see it, but it must be scary. Why don't you go to the other room and I'll take care of it?" If delusions or hallucinations constantly cause your loved one to become upset or stress and/or interfere with your ability to care for them, speak to their physician about possible medications to address these symptoms. Refusing care. Refusing care can be the result of a variety of different causes. Some of the causes include feeling privacy is being invaded, confusion about the task being done, forgetting that the task has not yet been completed, pain or feeling ill, mood disorders, delusions. Tips for when someone refuses care. Make sure they understand what you are asking them to do and why you are asking them. Focus on a reward that can come after completing the task. Offer a forced choice. This gives your loved one a sense that they are still in control of making decisions, but also still allows you to complete the task. Try to schedule the task at a time when you know your loved one is likely to be more relaxed and comfortable. Aggressive behaviors. In a future presentation on managing conflict, we will go over some of the causes of aggressive behaviors. They can often result as a culmination of multiple factors that come to a boiling point. Here are some of the common causes of aggressive behavior. Communication problems due to problems expressing themselves or understanding a conversation. Frustration performing a task they had been able to do before. Being unfamiliar with a place or people around them. Poor understanding of a situation. Sleeping problems. Feeling sick or being in pain. Anxiety or depression. Please refer to the presentation on managing conflict and combativeness for further details regarding these causes of aggressive behavior. Below is a reminder of the mnemonic introduced in the presentation Diffusing Conflict and Combativeness to help you remember ways to diffuse a tense situation. Please remember, if your loved one is constantly aggressive or is causing injury to themselves or others due to aggressive behavior, this needs urgent medical evaluation. Please call your physician for advice on how to manage this situation as soon as possible. Inappropriate behaviors. As dementia progresses, your loved one may start not wearing clothes or may remove clothes in inappropriate places or situations. They may touch areas of their body that should not be touched in a public setting. You may notice that they may start to make statements that are inappropriate, possibly sexual in nature. Your loved one may impulsively grab or touch parts of another person's body that they should not touch. This kind of behavior can be very upsetting and embarrassing for you and your family. However, please remember that these kind of behaviors are due to the dementia, because due to the dementia, your loved one may have a more difficult time controlling their thoughts and behaviors. Tips for managing inappropriate behaviors. Try to remain calm and gently redirect your loved one. If they have taken off their clothes, calmly help them put them back on. If they make inappropriate comments, change the topic of the conversation and distract them with an activity in another room. If removing clothing is an issue, you may consider purchasing clothing that is one piece and zippers in the back instead of the front. See the next slide for an example of this kind of outfit. If the behaviors are continuous and impair your ability to care for your loved one, please speak with your loved one's physician about options for medications that can be used to control these behaviors. This slide shows an example of an anti-strip suit. It is a type of suit that zippers in the back and is more difficult to remove. Cheaper options may be available, but the above link and image is a standard type of suit. In summary, mood disorders can arise in dementia due to damage in the brain as well as stress from life changes. These conditions can be and should be treated. Delusions and hallucinations may also occur during the course of dementia and may cause distress for your loved one. It is important to evaluate the causes of delusions and hallucinations in order to better target management. Using interventions suggested in the mnemonic "Saved by Support" may help curb aggressive behaviors. Care refusal can have multiple causes. Making a care activity simple and relaxed and giving your loved one a sense of independence can help decrease care refusals. Inappropriate behaviors are unintentional a majority of the time and can be managed with gently redirecting these behaviors. This concludes the presentation on personality and behavioral changes seen in dementia.